they always say, I don't want to have anything to do with politics.
Yeah,
And my answer is politics wants to do something with you.
that's right.
So you better get on board or we're going to lose, you know. So with that, I'm going to pass it to Dr. I can't see his name now.
It's Bonnie Tamraz.
Sorry.
No, that's okay, Mariam.
So the
Yeah.
other clubs that are sponsoring this event to introduce themselves and say a few words about their club as well. So,
Sure. Thank you again for the invite. My name is Bonnie Tamraz, and I am a member of the Assyrian Democrats of Bay Area. This is also a grassroots political organization that was inaugurated in 2021 last year by like-minded Assyrians trying to navigate the complexities of the age of information or misinformation for ourselves and our communities. I mean, our objectives are basically to provide a forum to help set progressive agenda that would benefit our Assyrian community at large, to promote progressive values such as democracy, equality, social and racial justice through education, participation, and advocacy. I'd like to inform, engage, register, and mobilize Assyrians and Democrats in our community. I'd like to endorse candidates and promote ballot measurements that can promote a progressive agenda. And obviously, voter outreach is also one of our goals to motivate Assyrians in our community, especially Assyrian Democrats, to turn out and vote. Our role is to bring clarity to our community on various important topics, such as healthcare, which we're discussing today, climate, immigration, energy, education, civil rights. You know, there are so many such great topics to explore and think about. And the first step in accomplishing that is informing ourselves, hence these seminars. I mean, these seminars are great. And I just wanted to give like a brief introduction on Assyrians, a word just in Assyrians. Assyrians are basically people native to the Middle East since ancient times. They're one of the oldest civilizations dating back to 2500 BC. Today, they are ethnic Christian minority groups scattered all over the world, but concentrated mostly in the Middle East, like in Iraq and Iran and United States. And with that brief introduction, I'll pass this on to Doreen from Jewish Democrats of Bay Area. Thank you.
Thank you so much. I'm delighted to be here and to be having this conversation, which is so important for all of us. I am Doreen Castleman. I'm the president of the Jewish Democratic Club of Silicon Valley. We are also grassroots, and Miriam, get this, we now are chartered in 2 counties. So yeah, San Mateo as well. This just happened. So we are 7.5 months old, and babies in a sense, but I think what has happened to us, which I think is exemplified but by what everyone is speaking of, there was a need to look at our community and see how we could engage in the democratic process, work with our 2 counties on a perspective that not only enhanced the Democratic Party, but looked at Jewish values, which for us is Tikkun Olam, looking at how to change and save the world. And certainly right now we're very involved with what's happening in Ukraine. It's a very important issue for us for refugee resettlement, which is a big part of Jewish values as well. So we're very, very glad to be here tonight. Thank you so much, and very excited to be able to engage more on this very important topic. And next will be
Krista.
Great.
That's me. Good evening, everyone. My name is Krista Hedeman. I am president of Progressive Democrats for Social Justice. Like the Assyrian group, we were just chartered last year. So we are definitely one of the newer clubs in Santa Clara County. Proudly founded by 3 public defenders. Our focus is to pursue transformational change in Santa Clara County, advocating for trauma-centered legal reform, economic equality, and healthy communities. So while our focus is definitely what's going on in the criminal courts, this is a topic that affects our entire community, and you can't have a safe community without a healthy one. And of course, we are proud of our own former public defender, Ash Kalra, who will be speaking tonight. So we are happy to be hosting. I'm happy to answer any questions, concerns. If you guys want to hit me up in the chat, I'm here for you. And so I have the pleasure tonight of introducing our host. She put this entire presentation together. She's the woman we all know and love, Suzanne Montaghi. She is an Iranian-American activist residing in South County, a member of the Santa Clara County and California Democratic Party. So I'll turn it over to you.
Thank you, everyone, and I appreciate the introduction. Welcome, and I want to just briefly introduce our assembly member, our wonderful assembly member, Ash Kalra. Ash, he has been a lawyer all his life. He's an attorney, served in Santa Clara County Public Defender's Office for 11 years. He was elected to California State Assembly back in 2016. And prior to being elected to Assembly, he was a member of San Jose City Council, where he represented District 2 in South San Jose for 8 years. Assembly member is the first South Asian Indian American to serve California state legislature. He supported Senator Bernie Sanders' 2020 presidential bid. And it's an honor to have you speak to us about AB 1400. Please go ahead.
Thank you so much, Suzanne, for organizing this with these other great clubs and for your friendship over so many years. And, you know, as Krista said, I mean, I think that when I think about being a public defender in my past, you know, how often health issues were related to what our clients were going through or lack of health. In fact, I actually had a client who, you know, it was a sad sap story if it wasn't, if the consequences weren't so severe. But, you know, he had just lost his job, lost his health insurance, and then found out his wife needed a hysterectomy and he didn't know how he was going to pay for it. And literally later that night, went and tried to rob a gas station. He didn't have any. He literally just put his hand in his pocket as if he had a weapon. But he got busted for that and ended up going to prison for many years. And the reality is that, I mean, I know that everyone should be responsible for their own behavior. I'm not excusing him his behavior, but the reality is that that kind of trauma is something that a lot of families go through every single day. And it manifests itself in many different ways, whether it's someone becoming homeless because they don't have health care, whether it's someone finding whatever, I mean, if you have a loved one that needs health care, whether it's stealing medication or doing what you have to do, you know, it's just like the idea of stealing bread if your children are hungry, right? And the reality is in the wealthiest state, in the wealthiest nation on earth, this should never be a reality. And so I introduced AB 1400 last year. And AB 1400, also known as CalCare, would establish a single-payer healthcare system in California for all Californians. And that's part of the motto is everyone in, nobody out. It includes everyone. And I do want to talk a little bit about, well, let me first say what I mean when I say a single payer system, because I know a lot of people talk about it and support it in principle. What it essentially means is that all the resources that currently come into our healthcare system would come into one fund. Right now, we have a multi-payer system which encompasses over 100 different private and public payers. That adds tens of billions of dollars of cost to our system every year because the administrative cost is enormous, as much as 20% a year. There's a reason why the VA has very low administrative costs. Even Medicare has very low administrative costs because once you establish someone is eligible, that's it. You know, my dad's sitting over here. Whenever my dad goes to the doctor, he just shows his Medicare card. That's it, right? They don't have to call the insurance. Are you eligible for this? Eligible for that? It's done. It's a done deal, right? Unfortunately, he has to, like many seniors, he has to have supplemental insurance, and we're seeing this scary trend towards privatization for full coverage, right? Which is another reason why we need single payer healthcare. If you think about it, people are having less children. That means people are entering the workforce less and less. We saw that in California, our population went down. We've seen our population's trends nationally go down over the last couple of years, not just because of COVID, but certainly because of immigration issues related to COVID, but also people are having less children. And so the Medicare system itself is unsustainable if we're always going to rely on the current workforce to have to pay enough to sustain a healthcare system that covers the most expensive patients, our elderly. And so we have to also understand that we have the most expensive healthcare system in the world by far, not even close. And yet we have the worst outcomes of any wealthy nation, and we have far worse outcomes than many other nations that some would be considered developing. And so the reality is that we are being fleeced with the healthcare system that's as profitable as ever, even through COVID, while more people are dying because of a lack of access to meaningful healthcare. In fact, we saw from June of 2019 to June of 2020, that only encompasses the beginning part of COVID. Black life expectancy went down 2.7 years, and Latino life expectancy went down 1.9 years. That's in 1 year. And that's indicative of our health, not just the fact that we have so many people of color that are working class that are forced to go to work as essential workers. A big part of that is also that they deem those that have certain pre-existing conditions to be more likely to suffer and die from COVID. And so we already know Latinos, African Americans suffer more from diabetes and from other illnesses. But we need to ask that next question. Why is that the case? Why do we live in a status quo that allows that to be the case? Because the reality is that not having access to healthcare is a big part of it. In fact, the number one indicator of those that all else equal, the number one indicator of those that died from COVID were lack of access to healthcare. The number one indicator of whether someone was going to die or not from COVID. And so, that's a quick kind of rundown of why we need CalCare, why we need single payer. The actual bill itself would set up a policy that would not only have a CalCare board that would be able to set up kind of a structure, payment structure, but also how doctors and other professionals will be paid for their services. And we also introduced ACA 11, which is a taxation payment structure. And keep in mind, there was a lot of opposition talking about, oh, you're going to be taxed this, $160 billion, whatever it is that they were putting out there. Let's keep in mind right now that our Californian families and businesses spend $220 billion on healthcare. What we're talking about is getting rid of that 220, but we have to replace it with something. And we're replacing it with far less money because the reality is we would need less money under a single payer system because of the dramatic cost savings. And so the last thing I'll mention, and we can open it up to something. I saw some of the advanced questions. I'm happy to answer some of them as well. I can start with them if you'd like. I think each club submitted a question. Is the process. So I introduced the bill last year in February, and the process of a bill is that it has to go through committees, policy committees in each of the houses. When I say each of the houses, I mean the Assembly and the Senate. So we're the Assembly instead of the House of Representatives. Whenever I go to schools and talk to them about it, schools don't teach a lot about anything below Congress and the White House and Supreme Court. So they don't know a lot about state government. And so, as you know, the Assembly, we're a separate house in the legislature. It's got to go through policy committees and the Appropriations Committee, which looks at the fiscal effect, then to the floor of the Assembly, then to the Senate, and go through that same process. Excuse me. And then with any major amendments, it has to go back to the House of Origin for what's called a concurrence vote, and then go to the governor's desk. And so 5 years ago, there was a bill that was introduced, SB 562, that made it through the Senate, but then was in the Assembly and didn't get a hearing at all. And the reason why I didn't get a hearing made a lot of sense. The Speaker of the Assembly, the same Speaker we have now, will have tremendous respect for, Anthony Rendon, said, well, How are you going to pay for it? What about the constitutional issues? Because there are constitutional issues with Prop 98, the GAN limit. These are things fixed in our Constitution that have to be accounted for. He asked some very reasonable questions and he didn't get any response. And so the bill didn't get a hearing and he got vilified for it. But the reality is, what do you want him to do? He wants us to be taken seriously. That means his questions need to be responded to seriously. So when I introduced AB 1400, we were having very serious conversations in the Speaker's office. And it didn't get heard in the first year. There was an opportunity to have it heard in April in the Revenue and Taxation Committee. But what that meant was it would be in one bill. And quite simply, what I mean by one bill is policy and fiscal. What that means quite simply is that the entire bill would need 2/3 of a vote to get out of the legislature. I wanted to keep the policy separate from the fiscal. So what we did is instead of holding that bill hearing, I decided to delay it so we can continue to work with the Speaker's office. And I went to New York, Canada, and even Washington, D.C. I met with the Health and Human Services Department. We learned a lot about the federal waiver process. And ultimately, the Speaker's office agreed to have 2 separate bills. That's when we introduced ACA 11 that deals with the constitutional and taxation issues in January. And we had AB 1400, the policy bill, that did go to the Health Committee. It got to the Health Committee and the Appropriations Committee. It was on the floor of the Assembly. I did not take it up for a hearing or I did not present the bill on the floor for a vote, because unfortunately, especially given the short amount of time we had to deal with the ACA 11 part, we only had 2-3 weeks to, if that, to try to get folks on board to understand that enough to feel comfortable voting for AB 1400. And we just didn't have nearly enough votes. And I felt that if we held a hearing, held a vote and it was dramatically low, it would have been really damaging to the policy. The policy survives now. We had the opportunity to bring it back. Remember, we were missing 4 Democrats in the legislature. So we're going to have 4 more, plus a lot of great progressives are running right now that are for single payer very publicly, including a lot of corporate free Democrats. By the way, there are only 2 corporate free Democrats out of 120 legislators right now, me and Alex Lee. And so we have a few more that look like they'll be joining us over these next few months into January. So I feel much more confident that we'll be able to have a much better vote count and to move this bill forward to the Senate. And so I was talking fast because I know that there's some really good questions and we want to make sure we get to questions as well. So would you like me to answer some of the questions that were sent from the clubs or the one first? Because I can certainly do that.
Yes, please, if you could, because
Yeah.
you're more, prepared
Yeah.
and you know what we are looking for.
Yeah,
And
no,
beyond
absolutely.
that, you would have a-
And I'll try to go relatively fast and fast enough so folks can understand me. I do tend to talk fast, but I want to make sure we get to as many questions as possible as well. So the question from the Jewish Democrats, the Affordable Care Act showed how government mandates, however well-intentioned, can detract from the benefits of healthcare expansion and create political deadlock. What lessons can we learn from the ACA in terms of AB 1400's universal aspiration? This is a great question because I always kind of grapple with kind of incrementalism versus going for what we know is the policy that I believe we need. And for example, before I go to the ACA, for example, this year, the governor in the budget proposed expanding Medi-Cal to every single resident in our state, including undocumented residents. I fully support it. It's a wonderful thing. So that could be considered an incremental step, expanding Medi-Cal. Medi-Cal has a lot of deficiencies. The reimbursement rates are really low. A lot of doctors don't take Medi-Cal, so you're not really giving the same access. But all things equal, it does raise the floor. And so I support that policy. Similarly, I support the ACA being expanded. However, let's keep this in mind. Before the ACA, the number one reason why families declared bankruptcy was for medical bills. Number one reason. After the ACA, the number one reason why family declared bankruptcy, medical bills. It hasn't changed, and the same ratio hasn't changed. So the ACA is a good thing in totality, but it's far short of what we need. And so the way I put it is, I think incrementalism is the best case against incrementalism. And what I mean by that is every time we take incremental actions, we see the numbers and we show that we're saving lives, we're saving money. And we know that we're kind of putting these little blocks together when we can build the whole building a single payer and achieve the life savings of tens of thousands of lives every year in our country, keeping hundreds of thousands from going bankrupt, and have a more just, equitable system that focuses on patient care, making sure doctors and nurses are paid, not worrying about whether insurance executives have yachts and jets. And so I think it's a very challenging proposition because yes, ACA was a huge step. It was really important. It has saved many lives. But I do think that let's not get caught up in thinking that that is the end of the discussion. We've got to keep fighting for what we know is a better system in my estimation. Question from ADBA. What was, and feel if anybody wants to, I know there's some hands up for other questions, but feel free to interrupt if you want a quick follow-up to anything I'm saying on these questions. Question from ADBA, what was Kaiser's impact on failure of the spill? Well, look, the entire insurance industry, medical hospital industry, of course, they're pivotal in making sure these bills die, including Kaiser. Absolutely. And Kaiser isn't one thing, right? Kaiser has the service delivery, the hospitals, the nurses, doctors, they're fantastic. But then it has it's combined with the payment system, right? And the insurance aspect of it. And so the reality is Kaiser's model itself could work really well in single payer to have a integrated system like that with global budgeting. So Kaiser itself could absolutely thrive, as they like to say, under single payer. But what would not happen is they wouldn't be able to make, billions of dollars of profit. And so, yeah, I mean, it doesn't help whenever you have these major entities, especially like Kaiser, that come forward and they don't do it publicly. It's not like you're going to see them at a community meeting. If I'm talking about CalCare, they're not going to come on here and say, we oppose single payer. No, they do it through trade organizations and they give money to front groups that, that's our political system. That's why we have to get money out of politics, right? But you all know the drill on how that happens. So yeah, they were not helpful and I don't anticipate they will be. Question from BAIAD, impact AB 1400 on businesses in California. Is AB 1400 a job killer? So there's a great question because the Chamber of Commerce uses the term job killer to help kill bills. The reality is that right now, if you think about the negative impact of the drain on our economy, because I mean, look, the 20% of our GDP is healthcare in our nation. That's a drain on our income. Think about all the jobs that are just, the cost to employers and how much more we could create. Because think of it this way, and right now, and in fact, I'm going to kind of integrate, there's a question here about how much businesses pay. So I'll try to integrate that into this answer. On average, a business pays 9.9% of payroll for healthcare. That's an enormous cost, 9.9%. That is if they pay for healthcare. The ones that don't pay for healthcare, like the Walmart, what have you, that don't provide healthcare, there's a reason why so many working class families, you hear about people working 2-3 jobs because they're working 20 hours here, 21 hours. They're working just enough to not be guaranteed healthcare, right? And so we subsidize it because the Walmart workers get Medi-Cal. So setting that aside, the average business going from 9.9% of payroll to a 1.25% payroll tax if they're more than 50 employees, I think that's a pretty good deal, right? Obviously, there's a gross receipts tax. I know there's a lot of questions and thoughts on that. Look, what I presented is the kind of my version of how we raise 150 plus billion dollars a year. There's no easy way to do it. But I think first of all, the average employer is going to pay far less. And if you talk to employers and have them pencil it out, and if we had more time between introducing ACA 11 and the decision of whether to have AB 1400 heard, we could have put a calculator, like you go online, enter your business's info, your personal income, but figure out how much personally you'll pay, how much you'd pay as a business. We just didn't have the time to get that up and running to address the attacks that were coming. So, but the average business I think it would be a huge boon if they don't have to worry about healthcare and they don't have to worry about their employees having healthcare or not. think about how much more productivity and peace of mind that they would have, because anyone that's an employer, how much control do you have when premiums go up double digits every year? Not very much, I imagine. Not very much at all. And that's part of the problem. And so the problem with getting business support is the trade organizations, Chamber of Commerce, Silicon Valley Leadership Group, all these groups oppose because such a big part of their membership are these hospitals and medical, associations and pharmaceutical companies. And so we need to get small businesses to step up and say, look, this is going to be good for us. We have to hear from these traders. And there's actually an individual named Wendell Potter. He was a vice president for Cigna. And for years, and he's basically trying to clear his soul now. He left and became a whistleblower. But for years, a big part of his goal was to demonize the Canadian system to make sure that we never went down the route of anything close to single payer healthcare. He now has come not full circle. He did a 180, so he went the opposite direction, and he's even started an organization, Businesses for Single Payer Healthcare. So you're starting to see some of those voices, especially those that would know, speaking up. I do want to ask a question, another one from BAID, impact to AB 14 on high earners as well as on low earning Californians. And so I'll get to some of those questions too. So if we look at some of those payroll taxes, what have you. So if you're high income, and I'll show, I took a picture of here we go. So if you make, let's see here. Oh shoot, okay. Let me see the question. Okay, 140 from 150 to 500. Okay, that's what we'll say here. So if you make over 149.5, let's just say 150,000. If you make under that, you get no additional taxes. If you make over that up to about 300,000, it's a 0.5% of taxable income, a marginal rate though. So it's only on that 150,000, right? And so on 150,000, 0.5%, that's $750 would be additional tax for someone making 150 to 300,000. And then someone making 500,000, it's 1% of taxable from 300,000 up. So that would be, let's see, 300,000 up. So 1%, 3,000 plus the 750, so it'll be $3,750 for someone making $500,000 a year of additional taxes. So that's the income on that, kind of that tax bracket range. And so it all depends, but right now, someone making 500,000 a year, I guarantee pays way more than that for healthcare for their family. And the fact that you'd have people under 150,000 paying nothing additional is a huge boon to so many families, so many working class families. Now, there is a payroll tax. So for someone making 50,000, 49,900, we'll say 50,000 for purposes of simplicity, there's a 1% payroll tax if you make over $50,000 a year. Now, let's keep in mind that currently the average person making between $50,000 and $100,000 a year is taxed 2.7% of payroll for healthcare. So that's a huge, and that's on it's not marginal. It's like if you make $70,000 a year, you're paying on average 2.7% of 70,000 for healthcare. So about $2,000, right? Give or take a year. Under this proposal, if you make $70,000 a year, you pay 1% of the marginal rate. So 1% of the 20,000, which is $200 a year. So your tax rate would go from $2,000 to $200 a year. So it's a huge benefit for working families, and so there's definitely a great boom. But I also would suggest for most families, it would be a benefit. And part of the reason we could do this is right now, companies like Walmart, people are making so much money. Fast food restaurants, they're not paying for healthcare right now because they don't hire for the most part for long enough hours for someone to get healthcare. And so they would be forced to pay in through a gross receipts tax. That's part of the reason why you have a gross receipts tax, to capture those resources. It's exempt for the first 2 million in gross receipts. And I understand that there are some concerns about using gross receipts tax. Again, this is all up for debate. I'm the first legislator, by the way, in 25 years of these bills being introduced, there's been 4 or 5 single payer bills. I'm the first legislator in history to actually put a funding mechanism forward. No one had ever done that before. And so I'm more than willing to take the criticisms of it, because, you know, that's part of being the first to do it. You have to be willing to have those honest conversations with folks. And so those are some of the questions that I see. Oh, one more question here is good. California already has near universal health coverage. So I hope that California gets 100% of access. And with the governor's new step to increase access for all undocumented residents by 2024, we're going to be very close to 100% of universal access. Now, what does universal access mean? Again, like I said, even with ACA, you're seeing medical bankruptcies, the #1 reason why families have bankruptcies. Under Medi-Cal, there are some places in our state, you have to drive 2-3 hours, even more, to get any kind of specialist, to get a tooth pulled in some places of our state, because not enough places take Medi-Cal. Under this, everyone would have to take CalCare. But there's one more point I want to leave with you, because I can, you know, I obviously have a lot of numbers in my head after studying this for a long time. The #1 Covered California, which is our ACA, which does a phenomenal job of getting people signed up. 30% of people on Covered California are under the bronze package, the bronze plan, which is the lowest plan. It's because they can't afford a higher plan. Well, the bronze plan has, I believe, an $8,400 deductible for individuals, $16,000 deductible for families. So do they have health insurance? Yes. Are they using it? Probably not as much as they should. If you're a family that can barely afford it, so you're getting the bronze package, you're not spending up to the $16,000. Now, it's great for catastrophic care, but even then you have to pay some out of pocket. And that's why some folks on ACA still go bankrupt or still have to have GoFundMe accounts, right? And so that's why universal access is very good, but it is not universal health care. I talked a lot, so feel free to ask questions or want me to, if I miss something, or want me to.
Mr. Cholera?
Yeah.
To the queue, okay. Mr. Maz, you can ask the first question.
Thank you, Assembly Member Cholera, for being here. I've been a single payer activist for several years, state level and federal level, and you know, presented the case to many clubs. I've gotten multiple resolutions passed. This last round for CalCare, I believe one of the reasons we still don't have it, in spite of its popularity and the fact that it makes absolute sense to have it, is that we don't have accountability of our politicians. At the federal level, there's this concept of, is someone a co-sponsor or not a co-sponsor? So there's some transparency in terms of whether they support it or not, even before a vote comes into effect. But at the state level, that transparency did not exist. I called my own assembly member multiple times. People told me he's a supporter, but I could not get his office to say how he was going to vote right up to the day of the vote, January 31st. I called repeatedly. I had multiple people call. And I repeated this for 2 other assembly members in my area. So when you pulled that bill on January 31st, at the very last second, regardless of your intention, the effect that that had was it deprived us the opportunity to hold our politicians accountable. Do you concede that that was the effect that your action had? And what will you do to prevent this from happening again? Because politicians are always going to say they're for this. But when it comes to the vote, they're going to back out and they're going to make all kinds of excuses why they can't vote for it.
I absolutely can see that was one of the, definitely one of the side effects of my decision. It wasn't the reason for it though. And so the reason for it is, you know, and I've told folks this, and I've talked about this a lot over the last a month or so, is that, look, my goal is to get this policy passed. And if we were closer, if I felt we would be in the 35, 36 plus votes, it would be a different scenario. And let me tell you why. With the number of vacancies we have, as well as the number of folks coming on board next year for single payer, I think the bill is in a much healthier place to take up for a vote to actually get it passed. And my goal is to get it passed. I'm not in the business of covering for colleagues, nor am I in the business of necessarily accountability for colleagues. My goal is to figure out how do we get the bill in a position to get the votes. Now, we had 56 Democrats, many of whom are terming out or leaving office or running for something else. We had about 28 that we had confirmed, or at least felt pretty well certain that they were going to vote for it. And so that means we need a dozen or so more votes for single payer, but hopefully a little more to be in a comfortable zone. Now, I do believe that we're going to have at least 4, if not as many as half a dozen more folks in favor of single payer in the legislature this time, by this time next year. It still means we need anywhere from 5 to 8 legislators that are incumbents to vote for it. And so, I'll get that question in a second. The reality is this: in our current system, when we have, if we want to talk about it politically, the election's in June, someone doesn't vote for it. Okay, some people get upset and they try to challenge it. In most cases, there's no challenger. The reality is only one challenger has been beaten by a progressive challenge in the last 10 years. And it was a huge coalition of folks that got together to do it. That's a practical statement, not a principled one in terms of whether it's the right thing to do or not to challenge someone because of a vote they took or didn't take, or if they declined to vote on it or did not vote on it. So there's enough of my colleagues that I believe I can get to the yes column. I know that sounds naive, but the reality is over the years, on a number of significant and number of progressive issues, we have seen progressive issues win in 2-3 years, where some folks voted for it the second year that didn't vote it in the first year. And a lot of that is momentum building. A lot of that is education. A lot of that is more grassroots effort. It's a combination of things. And I take a big role in that and making sure I can get enough colleagues there. I believe that if we held a vote that short, so basically I would be holding a vote knowing that I didn't have the votes. And so what would happen is those that didn't vote for it, in all likelihood, would win re-election. They would win re-election having not voted for single payer healthcare. They would win re-election with activists on the left that were mad at them and pushing on them and trying to vote them out or do whatever, hold them to account as they run for re-election. So now they just won re-election while taking a public stand either against or not voting for single payer, and they survived it. In my estimation, that makes them less likely to vote for it the next year. And I think if this was a different scenario where we didn't have so many open seats, my calculation would have been different. I can promise you that. But because of this moment in time where we have the most open seats in a decade, and I know a lot of the folks running that are corporate free, many are very vocally in favor of 1,400 as single payer. A lot of the folks that I'm talking about trying to get votes for, they didn't run on single payer. It's most people that run don't run on single payer. I did. I was very proudly in favor of it, but most don't, or they'll just talk about access, or I agree in principle, but they're not going to be like, I agree with single payer healthcare. I support 1,400. We have a lot of candidates right now that are very vocally in favor. And so that was my calculation. Like I've said to other folks, I know it's not about a moment, it's about the movement. I do think that in being focused on, and let's keep in mind, I didn't know, we're working on votes literally until that day, that morning, that lunchtime. And so it's not like I knew a week ahead. We were working all through the weekend. We started getting responses back that were not positive responses. And that's where the nurses and I had the same vote count at 28, that Monday morning. Could we have gotten more? Maybe if we put it up to a vote, maybe 1, 2, maybe 3 more if we're lucky. But I think that it's in a stronger position now for the policy to be voted successfully through the assembly than it's ever been. And no one expected it to get as far as it did. So a lot of folks didn't expect it to get a policy hearing, let alone get through 2 policy hearings and get to the floor. So, but like I said, I think that I was focused on the strategy and the policy of the moment. And I do believe I lost the sense of the movement and how disappointed folks in the movement would be.
Okay, Mr. James, do you want to ask your question, or Mr. Carter can just read it? Because I was told that.
Sure,
we go-
sure. Member of the Jewish Democratic Club of Silicon Valley. I wonder, is this a fee-for-service model? And if so, why would you choose a fee-for-service model?
It's not a fee for service model, strictly saying it's a gross receipts tax on all businesses. And so certainly some will be service oriented businesses, but it's not a direct fee for service model. And in fact, let me see here.
Well, when I say fee-for-service, what I mean is that providers, healthcare professionals will be paid.
Oh, I'm
for
sorry.
their
Oh,
services.
God.
Yeah.
Oh,
And
God.
the system that is, you know,
I was
that
still
has
thinking about,
significant-
yeah, I
that
got
has-
you.
Okay, it's
Okay.
a system that has significant issues.
I was thinking still about the taxation part. Okay. Yeah, no, it's not the fee for, so it's actually a hybrid of different types of payment. The CalCare system itself, as mentioned, yeah, it's a global budgeting system. However, there is fee for service when it comes to individual practitioners, if they're contracting directly with CalCare. But if you have a physician's group or a hospital, have you, or a hospital system, then it's global budgeting model. But it's hard to do global budgeting when it's a direct, provider. And there is an allowance for an ability for fee for service, but the system itself is not strictly based on fee for service.
Yeah, I think that is going to cause issues and problems for, all the known reasons that fee for service drives up costs.
Yeah.
And it's not a rational way to spend resources. And who's going to sort of oversee and decide what's covered and what's not covered?
Well, that's part, the CalCare system, does provide for not just a single board, but, to set up numerous advisory, committees made up of professionals that can speak to that. And in fact, determine what's covered. It actually, there's some degree of detail of what's covered in terms of types of areas, of practice areas, but in terms of specificity, that's part of what the CalCare organization would determine. And there is auditing measurements as well. And I know that, look, right now we have more fraud than any system in the world because of our multi-payer system. So would I say that there would never be or won't be fraud in a CalCare system? Well, you can't guarantee that, but there are checks and balances and measures in there for auditing and to ensure that the fee for service component of it is also checked. And that's where we would need expertise from folks as to how to best do that. But feel free to send feedback as well. He was here a moment ago. My chief of staff was on. I don't know if he stepped off, but I'm going to put his email in there because he's staffing me. He's the lead on CalCare. So if you do have any suggestions, advice, and thoughts that can help inform us better, feel free.
Let's go to next question then. Walter, do you want to ask your question?
Sure, yeah. Thank you for being here and providing this forum. My question is basically kind of a common question. You said that kind of a lot of these corporations, fast food, etc., don't pay tax because they don't pay enough hours, and so the people who work shorter hours, they don't have medical, and so they do multiple jobs. Those are the people who actually kind of can't cook, can't buy proper food, and they eat the food that is produced with a lot of sugar and salt and oils, and they're the one who gets sick. And it's been actually proven that when this type of food goes to countries as a new sort of type of food, it makes more people sick. So could there be a way to tax these companies more or maybe push them like a carbon tax and push them to maybe correct themselves even if they don't pay tax, at least at the end, if they fix the product, the processed food, the fast food, if they fix it, it doesn't make people sick, then that way, you have less people on being sick and being taken care of.
Yeah, I mean, I think you've opened up, and actually, I've been vegan. This is my 4th year being vegan, so I've done a lot of research on our health and our food delivery system, if that's what you want to call it. But you're 100% right that not just fast food, but even a lot of the things we get in the grocery store, what have you, have been so processed. And I think that is a important conversation, and I would absolutely support that. The reality is the volume of taxation we would need, although it sounds like you could, add a tax here, it wouldn't create the volume of what we would need for a single payer program. Now, it could create enough volume to help better inform and educate and provide health services for nutrition programs, for example. And in fact, part of CalCare is to focus more on preventative care, because if you start to actually pay general practitioners, pediatricians, OBGYNs, what have you, more than what they get now, especially under Medi-Cal. Like Medi-Cal will not be the floor under CalCare. It starts with Medicare on up. Then you have the opportunity to actually, like I remember when you've all probably remember years ago, you probably spent a lot more time with your doctor than you do now, right? And so we've lost that now doctors just prescribe medication, they're on to the next patient, and it's not always their fault. Like, they're dealing with paperwork now 10 times more than they did, a couple of decades ago. But I'm kind of wandering around, but back to your original question. I absolutely think that we need to do more to hold accountable those that are poisoning our children, poisoning our families. Absolutely. Right. We have fought, we try to do soda taxes. The soda industry played a really dangerous game with us. They always, part of our proposition problem is that they always challenge to go to the proposition route and to make sure we can never regulate them ever. So we had to back down on one of our tax proposals. That's the problem. We have so much money in our politics that if we try to go after the fast food industry, they'll fight back with the tools they have, which oftentimes are much more powerful than even as legislators, the tool we have. But I agree with 100% of what you said. I just think it's it would be a lot more complicated and complex, more because of the politics, not because of the principles to actually accomplish it.
Yeah, thanks.
No.
Very good. Sargon, you want to ask the next question?
Yeah, sure. Thank you, Assemblyman, for being here and giving us all that information. I work in a company where we're a small, basically size company, about 70, 75 employees. First, part of my question is more suggestion. Like a couple of years ago, we were notified the law changes of how to pay employees for sick time. Even though they're part-time or, something that the law basically mandated that we have to give them like a minimum sick time for it. And I'm thinking maybe insurance could be that way too, to push the employer where it doesn't matter if they're part-time, maybe if they work certain hours, like limit some amount of hours that they could have some kind of insurance. But my real question is, when I heard you saying that small employee need to be active and push or work to support this plan, I'm wondering how could small company do that? I'm here a decision maker on insurance, and I would really like to know what I could do to help this move in government.
Well, I mentioned the individual Wendell Potter, who started this national kind of campaign of businesses for single payer. I mean, I think that's something that, I think that small business owners like you need to, again, if you support it, I'm not going to tell anybody what to do, but if you do support it, find other like-minded and start an organization and start organizing, right? I mean, the organizations help to amplify, for example, there's physicians for a single payer healthcare plan, right? The national organization, they become very influential because they literally are physicians, and they help to advise on AB 1400. Not all, and they also had amendments and suggestions that weren't all met yet, but we were still in conversations. And so even as a small business owner, you can say, hey, I'm a small business owner in favor of single payer. It doesn't mean that you agree 100% with what's been proposed right at this moment. But what that means is, look, I'm willing to work to make this, to figure out how we make this work. And I don't mind paying some in taxes, as long as it's not egregious. I don't mind, as long as there's fair. And keep in mind, one other thing as a benefit to businesses is workers' compensation. Imagine if you have CalCare, if you have a single payer system, how much you can reduce workers' compensation costs because of Medicare, medical is already taken care of, right? So there are aspects of this that I really think, especially small businesses, can get behind. And so I think the first thing we'll do is just kind of educate yourself, not just on this particular bill, AB 1400 and ACA 11, but just on the kind of the concept of single payer, especially the financing mechanisms, the financing schemes that are used here and been proposed in other states or used in other countries. Because I'm not suggesting I have the right answers. And I think it will be really good to get a business perspective and more business perspectives on what could be feasible, in a single payer system. So I don't know of a California organization of small businesses for single payer. I do know there's a national organization. And so maybe starting a chapter, and it can start just by having convenings and doing education sessions similar to this one, where tough questions can be asked and kind of it could be a roundtable conversation of business owners that can really see, okay, how can we benefit from this? How can we support it? And how can we do it in a way that's sustainable?
Very good. So let's go. Walter, I guess I'll go to Mr. Mori Rahimi, then we'll come back. Mr. Mori.
Thank you. My question is that I am not as hopeful and optimistic as our distinguished speaker about next year. So could you please tell us what is the evidence that you have that next year there's going to be a better chance to pass this bill? Yeah. And then please tell us what our organizations can do for next year so that it will pass.
Okay. Well, you can, yeah. And so I'll start, well, actually, I'll kind of answer that in a hybrid. So the thing you can do to help is identify those elected officials running for state Senate and state assembly that are very vocally in favor of single payer healthcare, especially those that are corporate free. In San Francisco, there are a couple. I support Matt Haney. David Campos is also in the runoff. They're both corporate free for single payer. I support Liz Ortega, who's running in the Bill Quirk seat. There's also Jennifer Esteen. There's two people that are corporate free running on, in favor of single payer healthcare. Aisha Wahab is running for state Senate, very much in favor of single payer healthcare. And so that's the number one thing you can do, is to send reinforcements. And that is what can bring us some hope. And because right now, if you think about it, the San Francisco seat and the Quirk seat, the David Chu and the Quirk seat, those are two people, the people that are going to win those are in favor of single payer, like vocally. In the Mark Levine seat, even though he'll be leaving, that'll be a wash because someone will replace him. That looks like it's a favor of single payer. A huge one is we have a Republican being challenged by Pilar Schiavo in the LA area. Very much, she's a nurse. She was for Bernie, she's for single payer, she's corporate free, checks all those boxes. That would be a huge flip. Corey Jackson running in the Inland Empire for single payer. Georgette Gomez in a tough race. The corporations, all the money is coming against her right now in San Diego. She's very much for single payer. And so these are the races that we have to win in order to get enough votes. Jordan Cunningham, currently Republican, decided not to run for re-election because his district got redistricted. It's way heavy Democrat now. So over there, we have Don Addis and John Wizard running. Both will be good in terms of single payer. So that's what gives me some hope, because you can already hear by my talking about the different races that we have anywhere from 4 to 7 more people that could be elected in favor of single payer healthcare. That right there gets us into that, the mid-30s range. And that's why I feel more hopeful in getting, it's a big difference when you can get to that range in pushing the final handful you need. I've seen it happen on so many issues that have come before us in the past in the legislature. But that's what brings us some hope. And frankly, I was a public defender for 11 years. I'm in my 14th year as elected official. If I can't remain hopeful, then it's hard for me to do my job. I've gotten a lot of great things done. I've gotten a lot of things that I haven't been able to accomplish. But if I'm not hopeful, there's little hope for getting progressive stuff done in Sacramento.
I have a follow-up part. How about the leadership of the assembly? I mean, how come the leadership didn't help you get the votes? Because apparently the leadership knows ahead of time, even a month or two ahead of time, who's going to vote yes, who's going to vote no. How come the leadership didn't help?
Well, a couple of things, and I'm going to finish answering this question to answer that Newsom question, because that played a role as well. So the leadership was very helpful. In fact, worked with us for over a year, and it wouldn't have gotten as far as it did without the support of Speaker Rendon, the support of Chair Wood, the chair of the Health Committee, Chair Holden, the chair of the Appropriations Committee. Now, that being said, the speaker and leadership, they don't know the vote a month ahead, 2 months. It doesn't work that way. I didn't know the vote. I didn't even know if we were going to get it through Health Committee, in December. I mean, this is not like, it's not some big conspiracy where we're behind closed doors and we know exactly what's happening. Sometimes it may be easier if it were that way, but it's just not. And so I was the one, along with the sponsors, responsible for getting the votes, and we weren't able to get enough votes. And the speaker, the fact that it was in a position to be heard is a great credit to the speaker. Now, I will say this, that yes, Governor Newsom ran on single payer. Unfortunately, I think he was very harmful down the stretch by distancing himself from single payer, distancing himself by AB 1400, saying he hadn't read it, didn't know about it. When I introduced it last year, we reached out to his administration, to his staff a couple of times that they weren't interested or ready to engage on it because it was just introduced the bill. And so that's fine. They don't have to, but then don't go around and push yourself away from single payer healthcare. That, I think, had a lot of damaging effect on me being able to try to get yes votes. Because imagine me going to my colleagues and saying, yes, I have a whole plan. I went to DC, I met with Health and Human Services. We're going to apply for a waiver after we get a policy passed. Then we have a funding mechanism. We get the policy passed legislature, the governor is going to sign it. And they're like, wait a second, you mean that same governor that just said that he's never heard of it? And, it doesn't seem like he supports single payer so much right now. So you can imagine how that had a very distinct and severe dampening effect on the ability for us to get more folks that were on the bubble, because there are folks that are undecided on this. This is not something, this is a huge policy, the biggest one that any of us will vote on, quite possibly as a legislator. And so part of the issue was that the ACA 11, the funding aspect, came out late, even though we weren't voting on it, that didn't have the same time limit. And just so you all know, the process, January 31st was a deadline because it was a 2-year bill. The policy bill had the deadline of January 31st. But anyway, so I do think that the governor was, I think it was harmful.
Thank you.
Yeah.
I guess next is.
Just wanted to.
Who is it?
Can you just give me
go
2
ahead.
seconds? I noticed that some people are kind of dropping off. Maybe it's late for them or whatever, but I don't think so. There are some people here that I want to recognize, and as Maury alluded to, like Mr. Hadayek is the president of the San Diego Democratic American Democrats.
Oh, great.
Yes, and Dr. Magdi Hussein is representing MCA, Muslim Association.
Yeah,
Santa
it's great.
Clara.
Oh, yeah, they're great. I love you. It's great to see you. Yeah.
And Carol Garvey is
Thank you.
from Dawn. So my point is, as he said, we should be able to take it back to our friends and group members and say all these hocus pocus that they've created against it is not true. I mean, just listening to you, I'm not a big business person. I don't really do any finances stuff, but understanding that the cost from 200 billion is going to go down to 160, I think it's a thing to just say, yes, this is great. And we should
I mean,
support it.
and frankly, it was the opposition that was putting that number of 160 out there. There wasn't an exact cost estimate, but it's probably roughly in the ballpark. But they're putting that out there saying, oh, you're going to be taxed $160 billion. They ignore the fact that $220 billion of costs through premiums, deductibles, and copays goes away. Not to mention the emotional damage and physical harm, people not having access, people dying, people going homeless, people going bankrupt. But they don't want to talk about that. They just want to use fear, right?
And
so-
I agree with that. I used to work with the homeless. Main reason most of them were there because of the medical costs. They ended
Right.
up losing their home,
Absolutely.
ended up losing everything they had. And I had to, work with them to get them back to their
Absolutely.
jobs.
Well, Mr. Hadayi, if you're in San Diego, I think getting Georgette elected is huge. For single payer, honestly, in terms of the races happening down there, that's one that certainly we're keying on and hoping for. And there's a lot of money from industry, from the Chamber of Commerce and other industry groups coming in, funneling money that's coming in against her because they know she's going to be a strong progressive voice.
Yeah, unfortunately, she's not my assembly member or not my district, but I can tell you in San Diego County, we have a lot of, just to be very blunt, a lot of corporate Democrats. And
But she's in the area, so you can organize folks and work with the local Democratic
no, I
party.
understand.
Yeah, so I mean, that's what I mean. Like, if someone could live in my district, and some of you may, and they can help out Aisha Wahab just north of me, right? I mean, we've got to do what we can,
Absolutely. But just to jump, I want to second what you said about the harmful effect that Gavin Newsom had. I mean, I think I can go a lot further in saying how much he undermined it. And it's not coming from somebody who didn't understand the bill, just based on the way he verbalized his support for it during the campaign. It conveyed a complete understanding of the problem. And that's where it's really more harmful, is when you understand it and you turn around and undermine it to the behest of your donors. But my question is, what is your view about pushing this as a ballot measure and not to exonerate you guys? I think you guys still have to keep pushing for it at the assembly level, but in parallel to that, obviously the industry is going to come in gangbusters like they did with that other bill. I forget the contracting or
Oh yeah, Uber and Lyft
Uber Lyft one. Yeah. I mean, of course, I can just see the writing on the wall. That's going to play out again. But what is your view, and have you had any discussions with anyone about that?
Yeah, I mean, look, we know that if something like this, first of all, ACA 11 is set up to go to the ballot, right? But the reason why I was very happy to have it as a separate bill is that the policy can be passed. And then that allows the administration to apply for a federal waiver while we're still working on the ACA 11 to put it on the ballot. Now, we'd have to get 2/3 of a vote in the legislature to put that on the ballot. So we need a lot more progressive legislators to make that a reality. But the good news is that if we can make that happen, it only requires a 50% vote of the voters. That's why it's so huge. And so eventually, look at something of this nature, at some point, we're going to have to go toe to toe with the industry, because if we don't put it on the ballot, they will, and they'll do it on their terms. And so either we want it or not. And that means that we have to put the work in to combat the lies. They'll spend $500 million. Who knows how much they'll spend? We've got to be on the ground. We have to combat the lies. We have to put the work in. We have to be knocking on doors and everything, and that's what that's what it's going to take. I can put it out there. We can put it out there as activists. At the end of the day, polling doesn't matter. If you say 70% want single payer, at the end of the day, are people willing to vote for it when they know when it's all on the line? And that's really tough in our current political system that allows so much dirty money to come in, you know? And so, yeah, I see the article about the American Medical Association. Remember, the AMA opposed Medicare, right? I mean, you know, they oppose this. They'll always oppose it. And even though there's a lot of doctors, I think now a majority of doctors now support or are inclined to support single payer healthcare. The younger generation is very different. And there's hope there. And not just younger generation, there's a lot of doctors I've talked to that are retired or close to retiring that say it's changed. And this is not why I became a doctor. And now they're in favor of single payer because they know that we need a structural change. I have a couple more minutes if there's any last questions.
Assembly member, I personally have a common question also to ask. When I looked at your bill very carefully, and then I start, because we have a small business, very small business over here, manufacturing, and we do provide 100% health insurance, medical, dental, vision for our employees. So they don't have, they don't pay any part toward that. And when I looked at your proposal and the way the calculation of how much we are paying on annually for health insurance, I could see that we will be in better place. We will be paying less to because we offer Blue Cross, Anthem Blue Cross. So saying that for a lot of businesses, it does make a difference if they were informed properly.
Yeah.
If somebody reach out and say, hey, this is the percentage that your company would be contributing if your annual sales is this much. And believe me, they will see how much beneficial it is. So to me was communicating about this bill, not to criticize you, but still I'm criticizing you, has not been, you guys have not done a good job promoting this bill. Second, I am still confused between single payer and universal. We do a lot of international business. So for example, in Taiwan, it feels like they have universal health. What I mean is, the companies, people all contribute something, working or not, towards the insurance or their health, and then they just can choose their doctors, where they want to go, hospitals. In Japan, it feels like it's more like single payer, means that they just have one place that they pay to, and then from there, it gets distributed amongst all the, no private hospital, no private doctor, everything is national. So, have you looked at, first of all, can you define the difference of these two? If in California you decide, you decide to go with the single payer rather than universal, and why not?
So single payer healthcare is really not different than universal because it only deals with the payment. And what I mean by that is this is not a government takeover of the healthcare system. It's just who's paying. It's just like, if you have insurance or you have Medicare and you can go to a different doctor, a doctor's not coming in from the federal government and giving you a checkup. My dad's been going to the same doctor for 30 plus years. When he went from private insurance to Medicare, none of that changed. So this is not a government takeover of the healthcare delivery. There'll still be public hospitals. It's a public and private healthcare delivery system, just like we have now. It's just who pays is different. So in that sense, it's not like Japan. It's not like England's National Health Service and all that. It's more akin to Taiwan type healthcare in terms that there's private, public, and everybody pays in, and it goes into because it goes into one fund, and then everything comes out. I'm not sure about Japan, whether it's single payer or not, but I think that they do have a nationalized type healthcare delivery. But Taiwan, it would be more like Taiwan single payer universal healthcare. Universal meaning you can choose where you go, still have public and private practitioners. It's just the payments coming from one entity, everybody pays into it from different components. And then the other thing I want to say to what you said earlier is that, look, we tried and it's hard. We worked really hard on getting the word out. I do think on the funding aspect, because ACA 11 came out so late, that we ran out of runway. We did run out of time to have an effective strategy and messaging strategy against the industry. But I also will say that, look, more people are going to, trust you and Sargon and others that are business owners than me. Obviously, I'm going to espouse, oh, this is going to be great. It's going to be great for businesses. When business owners take a look at it and say it's much more powerful, right? And so it's got to be all of us together in terms of the communication and marketing of it. But there's no doubt that there's a lot more work that could have been done and needs to be done. I mean, this is a huge undertaking. And I think that absolutely there could have been better. It could have been better, certainly, in terms of the messaging. But remember, there was Facebook messages. I was getting attacked left and right. Everyone that made a contribution to my campaign, even friends I have in DC, were getting text messages attacking me. So they somehow got into my donor base and sent text messages saying how horrible I was and how much I was going to tax everybody. So that's who we're up against, right? And so they're ruthless, and we have to be relentless against that ruthless nature. But anyway, I think I gotta take off. But this is a great conversation. And so I don't know if there's any last comment, but I'm happy to do a little closing.
Just do it closing.
Yeah.
And thank you.
Yeah, no, thank you all so much. And thanks to all the participating clubs here, and even those that came in from other clubs and other parts of the state. This is a battle. This is a generational battle, and there have been several efforts to do it. And there's a reason why it hasn't been done. And so, we know what we're up against. The industry, every year we go without single payer, the industry gets more and more powerful. Like their superpowers increase because they get more and more wealthy and they understand that they want to hold on to what they have. But we just have to be better, bigger and better. And that does take all of us. And so I'm hopeful that we can, give it another shot. It doesn't mean that it's going to be easy. And anything worthwhile, anything doing that's worthwhile isn't easy. So I just want to thank all of you for the really good questions, for caring enough, even after the bill, even after the bill was held and didn't make it through the assembly, still wanting to have this conversation, because that's what we need. The conversation can't stop. So thank you all so much.